Welcome to the Red Wagon, a podcast for employees and friends of Children's of Alabama. I'm Tiffany Kazarowski. September is Sepsis Awareness Month, and here with us today is Dr. Jeremy Loberger, the Children's Sepsis Physician Champion. Dr. Loberger completed his critical care fellowship here at Children's and has been on faculty since July. So welcome, Dr. Loberger.
Thank you.
Tell us, what is sepsis exactly, and then why is it so important for us to have a month?
So sepsis is on this continuum. You can have an infection but not have sepsis. You know, a kid could have an ear infection and that's all it is. They get antibiotics. But on that spectrum, that infection can get out of control. Your body's trying to react to it, and it's this dysregulated response. And that's when you develop sepsis and you start having things like your kidneys get damaged or your lungs start to get sicker. And then further on in that spectrum is what people know as septic shock, where your blood pressure starts to drop and you need to be in an ICU on things like ventilators, needing medicine to keep your blood pressure up, needing to even be on dialysis. It's a hard thing to define, but it's on this huge spectrum of very uncomplicated infection all the way to shock and potentially death.
And then what about sepsis awareness? Why do we need to bring attention to this for Sepsis Awareness Month?
Most of healthcare is time dependent. You need to identify something and treat it, but that's even more so for sepsis. And so sepsis, the outcomes, the mortality and morbidity associated with it is directly related to how soon you identify and then how quickly you treat it. And so to identify sepsis, it takes more than just a physician, more than just a nurse. It takes an entire team because there's a lot of people that are seeing a child at various parts of the day, and people need to be aware of it, need to discuss it. Say the S word is what we talk about, right? You got to put a name to it. And because if you can identify it and treat it, you improve outcomes.
What are we seeing here at Children's in terms of numbers, outcomes, et cetera?
Back in 2017, we joined a collaborative of peer hospitals, initially about 40 hospitals. Now it's well over 50 with the Children's Hospital Association. And they have, within that organization, there's the Improving Sepsis Outcomes Collaborative, and that's what we're part of. And what the goal of that collaborative is to pool all of our resources on a national basis. How do we address quality improvement around the topic of sepsis with the goal of improving outcomes? And so one of the things that we tackled first is identification. And so in May of 2018, we rolled out what most people listening to this podcast know, sepsis red and yellow. And so what that is children are constantly screened for sepsis. Nurses, every time with vital sign checks, are encouraged to answer certain questions that put a patient at risk for sepsis, and then do they have signs or symptoms of sepsis? If that triggers positive, that encourages them to go ahead and page the medical team involved and have what we call a huddle. Just discuss it. Do they have sepsis or not? And if they do, let's treat. If they don't, okay, but at least we asked it. And so that rolled out in May of 2018, and now we've transitioned to where we're constantly refining that tool, but now we're working on, all right, we're identifying them. How do we get treatment to them faster and more effectively?
So that's basically what we're doing to prevent more sepsis.
Right.
Okay.
Right.
How can people get involved if they're interested in learning more about your team and learning more about what our prevention methods are here?
We have several different ways you can get involved, and you can always reach out and contact me. Our team coordinator is Sherry Green with Process Improvement. We will get you plugged in whatever part of it interests you. We have regular meetings with a multidisciplinary group every month that helps us kind of deploy our interventions, discuss our successes and our failures. We're very much preoccupied with failing. Any opportunity that we see to improve, we look at that very seriously, discuss it with the group, and that's where people can get involved. Because what might work, for example, for my field in the PICU may not work for the bone marrow transplant unit, for example. So it takes people from all parts of the hospital in all fields, respiratory therapy, nursing, physicians, nurse practitioners, to pool our resources to identify this serious problem and treat kids well.
What kind of improvements do you think we've made since you started your fellowship here and to now?
I think we've made some dramatic improvements, and I think it's important, too, to give credit where credit is due. I wasn't the person who initially started this, so Dr. Chris Pruitt, who's now left to take a leadership position in another hospital, started this program, and so I want to give him a lot of credit for that. But since starting just screening in May of 2018, I brought these numbers with me so I quote them correctly.
Yeah.
The hospital onset sepsis, so the rate that kids develop sepsis in our hospital, which we don't want to happen. We're
Right.
the experts, so we should be able to identify it and prevent it. That's dropped by 62% in that time frame. And then the really important outcome, we care about a lot of things, but death obviously is number one. And so we want to decrease mortality. We've cut that in half of kids dying from sepsis in our hospital. That kind of thing doesn't happen without, from the very top of our hospital, Mr. Warren, Dr. Cohen, everybody, really this concerted effort, we're all working together. That's an incredible outcome. And then the two things that really have likely led to a lot of that mortality outcome, because we know based on evidence that these are the two things that help, getting kids antibiotics and getting them fluids. Our goal is to get them their first dose of antibiotics in about 60 minutes or less, fluids in less than 20 minutes. We've cut both of those times in more than half. And so I think it tells me that people are recognizing sepsis and then they're prioritizing treating. People realize that what they do in that moment is so incredibly important.
What led you to become involved in the sepsis implementation team, and why are you so passionate about it?
My chance to get involved in it, honestly, was a little bit of dumb luck. Dr. Pruitt was leaving, and I got encouraged to participate by our division director. But I think sepsis awareness and being passionate about sepsis is really something that comes naturally to an ICU doctor. We only halfway joke with the residents, and we say that you should always prove it's not sepsis. Like, we're always in our mind thinking, is this not sepsis? We got to make ourselves believe it.
Right.
So it was a very easy niche for me to fill, and I just love doing it. And it's not just sepsis, too. It's the opportunity to work with this huge team and have real outcomes that affect patients every day, and that's what's really cool.
Absolutely. Well, thanks so much, Dr. Loberger,
Thank
for
you.
joining us. And we will provide a couple of different resources, should be right there in the show notes for people to access.
Thank you very much.
Thanks for joining us for the Red Wagon Podcast.